Consultation and skin analysis. During this lesson, you're going to identify and distinguish between various common skin types, describe the structure and function of cleansers, moisturisers and exfoliants, investigate how different skincare products affect various skin types, accurately identify a client's skin type to recommend suitable treatments, and suggest the most appropriate skincare products based on the identified skin type and treatment needs. To discover the client's normal skincare routine and the products they use, it's crucial to ask detailed and specific questions during the initial consultation. You should begin by asking about their daily skincare routine, including the products they use in the morning and evening, inquire about any previous facial treatments they've had and their outcomes, and ask if they have any known allergies or sensitivities to any skincare products. You should also discuss their primary skin concerns such as acne, dryness or wrinkles and what their skincare goals are. Additionally, ask how their skin typically reacts to new products or treatments. This thorough questioning helps in understanding the client's needs and tailoring a suitable treatment plan specifically for them. The visual examination must be conducted in good lighting, ensuring that the skin is free from makeup and properly cleansed. During this process, the therapist should carefully inspect the skin to identify and record any problem areas, such as an oily T-zone and blackheads. This examination helps in accurately assessing the skin's condition and tailoring the treatment accordingly. Manually examining the face provides valuable indications about the texture, elasticity, and warmth of the skin. The skin's warmth indicates good blood circulation in the face. By examining and feeling the skin, the therapist can gather information about its texture and identify any lumps under the skin that may require further examination. This tactile assessment is crucial for understanding the skin's condition and planning appropriate treatments. For testing skin tone, gently lift the skin between two fingers at the cheek and then release. Good skin tone will return to its original shape immediately. This simple test helps to assess the skin's elasticity and overall health, providing valuable information for planning effective treatments. When carrying out a skin analysis, it's essential to check for any contraindications that could prevent or restrict the treatment from being carried out. The contraindications relevant to all kinds of facial treatment are conditions such as conjunctivitis, sunburns, cuts on the skin, severe eye infections, bruising, known allergic reactions to products, or recent scar tissue. When the beauty therapist examines the skin and discovers any contraindications, treatment must not be provided. This is to protect the therapist, the client, and other clients who could be at risk of cross-infection. During the consultation, beauty therapists should discuss the details of each treatment with the client, including what the treatment involves, its duration, aftercare, and any additional precautions the client must take at home. The client should also be informed about the cost of any individual treatments or a course of treatment, if needed, to help them decide if they're willing to make the financial investment. You should bear in mind the following points during a facial treatment consultation. Record personal details about the client and ensure no contraindications are present for the facial treatment. Avoid providing any treatment if contraindications are detected. Gather information about the client's general health and skincare routine through questions, and then explain the necessary treatment required, aftercare, and any costs associated with the treatment plan. You should also provide professional and honest advice. It's important for the beauty therapist to accurately recognise the client's skin type in order to select the appropriate facial treatments and suitable skincare products. This can only be achieved after a thorough assessment of the client's skin. Diagnosing the true skin type can be challenging because skin reacts differently to various products, environments, and lifestyles. The four main types of skin are normal, dry, oily, and combination. Normal skin is generally known as balanced skin because it's neither too dry or too oily. This skin type has the right balance of oil and moisture, keeping it soft, smooth, and fine textured with no visible pores. Normal skin feels firm and warm when touched, and its pigmentation is evenly coloured, typically free from blemishes. However, normal skin can occasionally become slightly greasy or somewhat dry, so assuming it will always remain normal is not accurate. During a skin analysis, clients with normal skin should be asked the following questions. Is this the usual condition of your skin? Do you think you have any problem areas? Have you had any problem areas in the past? What products and routines do you use for your skin? Dry skin is characterised by a lack of moisture and oil. The pores are tight and small, and the skin has poor moisture content. This type of skin tends to be sensitive and wrinkles appear quickly, leading to premature aging. The type of questions you could ask your client is, do you feel that your skin is tight? Does your skin feel sensitive in cold and hot weather? Or does your skin sometimes flake? Dry skin can sometimes worsen if it's washed with tap water, as it contains chlorine and salts. If a client has severely dry skin, you should advise them to avoid using tap water on their face. When sebaceous glands overproduce sebum, the skin can become greasy. This type of skin has a thicker appearance compared to normal skin, with larger pores and higher moisture content. The excess sebum production causes dead cells to become embedded in the sebum. Greasy skin often has sluggish lymph and blood circulation, and the shine is caused by the overproduction of sebum. Excessively greasy skin can lead to various skin disorders. Questions that you might ask your client is, are you prone to blackheads and pimples? Do you usually have shiny skin? Do you find it difficult to keep makeup on your skin? Combination skin is usually a mix of dry and oily areas. The oily areas are usually the forehead, nose and chin, known as the T-zone, while the cheek area is often dry and normal. In combination skin, the T-zone pores become enlarged, whereas the pores in the cheeks remain small or medium size. The skin in oily areas can become sallow, while the skin in dry areas tends to become thin. Skin tone in the dry areas may be poor, but the tone in oily areas generally remains good. The type of questions you could ask your client is, does your nose look shiny often? Are you prone to blackheads in the T-zone sections? Is your skin on the cheek areas tight or dry? Now you can pause the video and do a little activity. Write down your observations and conclusions about your skin type. The first activity is observe the skin of a family member closely. What do you see? Note down your observations about their skin and consider aspects such as their skin type, pore size, texture, any visible concerns, and overall appearance. Then for the second activity, look at your own skin very closely in strong light and determine your skin type. Consider the following. Is your skin usually shiny or matte? Do you notice any dry or flaky areas? Are there any areas where your pores are more prominent? How does your skin feel to the touch? And note any recurring skin issues such as acne, redness, or any sensitivity. Secondary skin types refer to specific skin conditions that can occur in conjunction with the primary skin types, which are your normal, dry, oily, and combination skin, such as sensitive, dehydrated, mature, or acne-prone skin. Sensitive skin is usually associated with dry or pale skin, which lacks sufficient production of sebum. The skin type often appears flushed and tends to become discoloured very easily. Sensitive skin frequently reacts to beauty products used in salons. It feels warm to the touch and often has broken capillaries on the cheek area. Questions that you could ask your client: is your skin usually dry? Does it look red, particularly in the cheek area? Does your skin have a tendency to suffer from allergic reactions? Dehydrated skin is a condition where the skin tissues have lost water. All skin types can suffer from dehydration due to the use of harsh products or exposure to central heating or extreme temperatures. Dehydrated skin often shows fine superficial lines clearly and frequently has broken capillaries. Questions that you could ask your client: are you consuming a sufficient amount of water? Have there been any recent changes in your diet? What skincare products do you use? Describe your skincare routine. Clients with dehydrated skin should be advised to drink 6 to 8 glasses of water a day. This will help replenish the moisture content in the bodies and improve their skin's hydration. As the skin matures, wrinkles begin to form. The epidermis becomes thinner and there is a loss of elasticity and reduced support from the underlying muscles. Additionally, the sweat glands and sebaceous glands gradually become less active with age, resulting in skin that's typically dry. Questions that you could ask your client: do you feel your skin has lost its firmness or elasticity? Is your skin typically dry or does it lack moisture? Have you observed any changes in thickness or texture of your skin recently? What skincare products do you currently use for anti-aging or moisturising? Have you experienced any changes in your skin sensitivity? How do you protect your skin from sun exposure and environmental factors? Congested skin occurs when pores become blocked, preventing sebum and sweat from flowing to the skin surface. This can cause the skin to appear and feel coarse and lumpy, with visible whiteheads and blackheads. Congested skin can result from poor makeup removal routines, using the wrong products, and excessive sweating. Questions that you could ask your client: do you notice whiteheads or blackheads on your skin? Does your skin feel coarse or lumpy to the touch? How often do you remove your makeup? What products do you use for cleansing and skincare? Do you sweat excessively, and if so, how do you manage it? Have you observed any particular times or conditions where your skin feels more congested? Do you experience any irritation or breakouts after using certain products? Infected skin can be caused by viruses, fungi, or bacteria. Visible signs include irritation and swelling, and the presence of pus is also a common symptom. Questions which you could ask your client if you suspect that they've got infected skin is: have you noticed any swelling or irritation on your skin? Is there any presence of pus or unusual discharge? Have you had any recent cuts, scratches, or wounds on your skin? Have you experienced any itching or burning sensations? Have you used any new skincare products recently? Do you have a history of skin infections or any known skin conditions? This could be herpes, cold sores. Have you been in contact with anyone who has a skin infection? To maintain healthy skin, you should consider the following important steps. Establish good nutritional habits. Consume a balanced diet rich in vitamins, minerals, and antioxidants to nourish the skin from within. Avoid stress. Manage stress through relaxation techniques, exercise, and adequate sleep, as stress can negatively affect the skin's health. Use suitable skincare products. You should choose skincare products that are appropriate for the skin type and address specific skin concerns. Protect the skin. You should always avoid any type of damage to the skin, including sun exposure, harsh weather conditions, and physical trauma. Use SPF, wear protective clothing, and follow a gentle skincare routine to minimize damage. The reasons for skin damage and how to recognise symptoms. Using skincare products incorrectly can lead to the formation of comedones or cause the skin to become oversensitive. Excessive heat can result in dehydrated skin and burns. Exposure to pollutants, chemicals, and the ozone layer can cause dehydration, locked and clogged pores, and overactivity of the sebaceous glands, leading to various skin problems. Excessive exposure to UV light or artificial light can lead to excessive wrinkles, fine lines, and premature aging by breaking down the elastin and collagen. This is what protects the skin. It can also cause hyperpigmentation in the skin. A wide variety of products are available in the market to improve facial skin conditions, such as toners, cleansers, moisturisers, masks, massage products, and exfoliates. When providing treatments to sensitive skin, you should always select products that don't contain common allergens such as alcohol, lanolin, or mineral oil. These products are usually labelled as dermatologically tested or hypoallergenic. Different cleansing preparations are used by beauty therapists. These formulations are designed to be suitable for various skin types, and they include cleansing creams, cleansing milks, cleansing lotions, cleansing bars, foaming facial cleansers, and eye makeup removing products. And the characteristics of effective cleansers are they must remove all makeup, dirt and grease. They must cleanse the skin thoroughly. They must be pleasant to the feel. They must be easily removed from the skin. And they must maintain the skin's pH balance. The alkalinity or acidity of a substance is measured by the pH scale. The pH of acids is less than 7, while the pH of alkalines is more than 7. Neutral substances have a pH of 7. To avoid skin irritation, beauty therapists should preferably use products with a pH between 5.5 and 5.6. Alkalines can harm the skin's protective covering made of sebum, making it appear and feel dry. To determine whether a liquid substance is alkaline or acidic, a simple test can be done with litmus paper, which changes colour according to the pH. In the presence of an alkali, the litmus paper will turn blue, and in the presence of an acid, the litmus paper will turn red. Key ingredients in cleansing creams are waxes, which provide a creamy texture, a combination of various oils, which contribute to the cleansing action and provide moisture, water, which offers a texture that allows for easier application and spreading while also cooling the skin, preservatives, ensure the product remains stable and free from microbial contamination. Fragrance, which adds a pleasant scent to the products. The difference between cleansing creams and cleansing milks is cleansing creams have a thicker and richer emulsion compared to cleansing milks, and this makes them more effective at removing oil and grease-based makeup from the skin. Cleansing creams are particularly beneficial for treating very dry skin, deep cleansing, and removing makeup. Cleansing creams are the best option for those needing a thorough cleanse and adding moisture to the skin. The key ingredients for cleansing milks include a mixture of oils, generally mineral oils, emulsifiers, detergents, large portions of water, and smaller amounts of waxes compared to cleansing creams. The benefits and uses of cleansing milks is for drier skin treatments, especially for skin that is sensitive or prone to sensitivity. However, they're not ideal for very dry skin types. Cleansing milks are sometimes used for washing off the skin. Cleansing milks are perfect for those who prefer a lighter feel on the skin, people with oilier skin types, and younger skin types. These products provide gentle cleansing without heaviness of creams, making them suitable for various skin types and preferences. Key ingredients for cleansing lotions include water and detergent solutions, antibacterial agents, fragrance and emulsifiers. Cleansing lotions typically do not contain oil and are not suitable for removing makeup. Instead, they're used to treat greasy skin and are also useful for cleansing normal skin types. They're ideal for blemished or problematic skin and younger skin types. They provide effective cleansing without adding oil, making them suitable for managing oily and blemish-prone skin. Key ingredients in cleansing gels include a mixture of wetting and cleansing agents, water-soluble elements and water, colours and conditioners. Supplementary ingredients are selected for the treatment of various skin types. Cleansing gels can be used quickly and offer a suitable alternative for clients who prefer washing their faces with water and soap. If the makeup is oil-based, cleansing milk should be used to remove it before using these cleansers. Cleansing gels are convenient for quick and easy face washing, clients who prefer a water-based cleansing routine, and refreshing and conditioning the skin during cleansing. Soap is usually considered inappropriate for use on the skin. This is because the alkaline pH disturbs the skin's natural acidic pH balance. Additionally, soap leaves insoluble salts on the surface of the skin. Cleansing bars are much milder alternatives to soap, and they are recommended for skin types that are not overly sensitive, such as normal to oily skin. Cleansing bars offer a gentler cleansing option while still providing effective cleaning for less sensitive skin types. Eye makeup removing products should be non-greasy, light and easy to use to prevent dragging the delicate skin around the eyes. Effective eye makeup removers dissolve makeup instantly. However, special oil-based makeup removing products may be required to remove waterproof mascara. Key ingredients in eye creams include oils, herb and plant extracts, vitamins, oil and water mixtures, methylcellulose, azulene and collagen. Using eye creams regularly is essential to postponing the formation of wrinkles. The best time to start an eye protection routine is before the formation of lines. By incorporating eye creams early on, you can help maintain the skin's elasticity and hydration, reducing the risk of premature aging around the eyes. Key ingredients for skin fresheners and toners include fragrance and water, astringents, extracts from plants, alcohol and humectants. Skin fresheners and toners are applied to the skin with damp cotton wool in firm yet gentle strokes all over the face. This process removes all traces of grease, leaving the skin clean and ready to receive moisture. By incorporating these products into the skincare routine, you ensure a thorough cleansing and prepare your skin for optimal hydration. Key ingredients in exfoliates include sodium lactate, detergent, abrasive powders, kaolin, additional moisturizers and vitamins. Exfoliants help remove dead skin cells from the top layer of the epidermis, improving the skin's colour and texture while stimulating circulation. Exfoliants should be used once a week, and there are several different kinds of exfoliants, including vegetable-based and chemical-based options. Regular use of exfoliants promotes a brighter, smoother complexion and helps maintain healthy skin. Pore grains are the most common type of exfoliants. They usually contain a liquid or a cream base with small spears made of crushed nuts or polished plastic. To help protect the environment, I recommend to avoid using plastic and use natural products. The exfoliant is massaged gently over the surface of the skin, helping to remove dead skin cells and improve skin texture. Regular use can enhance skin appearance by promoting a smoother and brighter complexion. Clay exfoliants have a clay base and are applied similar to a face mask. The mixture dries slowly, allowing the clay to absorb sebum and dead skin cells. Once completely dry, the mask is gently removed using the finger pads. Apply the clay exfoliant evenly to the skin, allowing it to dry completely. As the clay dries, it absorbs excess oil and dead skin cells. Gently remove the dry mask with your finger pads to reveal smoother, clearer skin. Key ingredients in moisturising creams includes emulsifiers, a mixture of waxes and oils, and humectants. Moisturising creams usually contain 15 to 30% oil and 70 to 85% water. They can be used during the day or at night, depending on the specific cream and the skin type. Moisturising creams are usually recommended for mature and dry skin types, however, they should not be applied in areas near the eyes. The benefits of moisturising creams includes it provides essential moisture to the skin, helps maintain the skin's elasticity and smoothness, and forms a barrier to protect the skin from environmental damage. Key ingredients in moisturising lotions include 10 to 15% oil, 75 to 85% water. Moisturising lotions have a light liquid formation, making them ideal for use beneath makeup. They're recommended for young combination skin, greasy skin, normal skin and dehydrated skin. While using various beauty products, it's essential to follow the manufacturer's instructions because these instructions provide important information about the safe usage of the products, including how to apply the product correctly, how to store it, and the duration, meaning how long the product can be left on the skin. By adhering to these guidelines, you can ensure that the products are used safely and effectively and maximising their benefits. When carrying out facial treatments for clients, it's important to advise your client how to care for the skin at home. So providing your clients with a skincare routine you can give them advice on what to do when they're not at the salon. The procedure is for cleansing. They should be cleansing morning and night. Cleansing removes dirt, dust and makeup from the skin. Products include cleansing lotions, milks, creams, gels and cleansing bars. Your clients can use day cream or moisturising cream or lotion. Moisturisers keep the skin supple and soft, restores oil to the skin. Toning, morning and night, tightens the skin and stimulates circulation. The products include skin tonic, astringents and toning lotions. Your clients can exfoliate once a week. This removes dead skin cells. Face mask once a week, which deep cleanses and smooths the skin. There's various different types of masks available, which we'll go through as we move further along the course, such as clay masks, peel-off masks, fruit masks, biological masks and thermal masks. An eye makeup remover, which they can use at night when they're taking the makeup off. This comes in lotions, creams and washing gels. If you'd like to test your knowledge on what you've learned throughout this lesson, feel free to follow the QR code and it will just take you to a little self-evaluation test.